And yes, you are very right. It raises the questions about, you know, the availability of PPEs across the country. We're told that we have about 200 health staff, 200,000 health staff across the country, at least in the public services. And it is important to ensure that all of them are adequately prepared for this battle that we have and are adequately, you know, suited and protected. The government of Ghana, in the midst of the global challenge where all over the world equipment is in short supply, it's been working strenuously to ensure that we get as much equipment as possible out there. And indeed, currently, we've got a significant chunk of PPEs that have come in. There are different types of PPEs depending on where you are. If you're in the ICU, if you are pre-triage, etc. The reports, or some of the reports that we are getting from some of the health facilities, are that they don't have it. I have doctor friends who say, Kojo, we hear what you guys are saying at the top, but we don't have it here.
The reality.
And so the president has instructed that we do a quick validation, because we are aware that we've sent a good chunk through the system to the regional levels. We've also sent money to regional directors that, listen, if it's the deployment that is difficult, you can buy a bit from the open market and ensure that people have it. So the president has instructed that we quickly do a validation out there on the ground, because in some of the instances you are finding out that there are PPEs that are available in the stores, but not necessarily in full supply for everybody at the hospital. In one of the incidents that came to me, those in the ICU treatment center have PPEs, but those sitting at OPD or emergency don't have it, even though the hospital has it in store. So some more instructions are going, and that's why again today we appeal to the medical directors that right now we should treat every case that comes to the hospital with that mindset that this is a possible case. And so people must be prepared, and where there are gaps, we've been asked to quickly validate. In the next, I think, about 24 hours, we're going to put out a hotline for validating so that we can also get a lot of feedback from the ground and then quickly move to plug some of those holes.